So welcome everybody. We're still missing one speaker, but I think we'll just start with an introduction and welcome to our final Living Well with Cancer webinar. This has been a really interesting year, hasn't it? I mean, we're all probably a little bit zoomed out and got very used to joining webinars rather than meeting in face-to-face. But we thought we'd take the opportunity as a multidisciplinary team to talk to all of you and introduce you to a multidisciplinary approach to one of the most complex symptoms that people face, which is that of sleep disturbance. And this is with cancer. So during cancer treatment, sleep disturbances has been found to be one of the most prevalent symptoms, the most common symptoms that people experience during cancer, and also up to 5 years after cancer diagnosis into survivorship. So I'm going to really privileged today to host a selection of speakers from our multidisciplinary team here in the Living Room. The Living Room is the home of integrative oncology and supportive care here at Chris O'Brien Lifehouse, a comprehensive cancer hospital here in Sydney, Australia. This webinar is really for your information. It doesn't replace medical advice. And if you do have any concerns, please see your doctor or treating team so they can assist and help you. This is really just to inform you and give you an insight into the approach to this really difficult problem. So what I'd like to do is just introduce you to our team. It's a bit like the Brady Bunch. I think we fit the screen beautifully today. There's a couple of blank screens as our exercise physiologist, Dr. Shelley Kay, joins us. So you'll meet, and I'll get our participants just to give a wave as I go around and introduce them. There are still some people coming in, so welcome everybody as you join our webinar. Gretel Spiegel is our reflexologist. She is she has many other talents as well, but she'll be talking about clinical reflexology today. She's been working with cancer patients for many years and working at Lifehouse since it opened 7 years ago. And she has an amazing gift, and will introduce you to the world of reflexology and its role in sleep management. Dr. Victoria Choi is one of our acupuncturists. Dr. Choi did her PhD in the mechanism of acupuncture. She works with cancer patients and is really interested in the role of acupuncture in managing cancer-related symptoms during treatment and also beyond and into the survivorship space. And so Victoria will share some of her insights with us today. Chris Dixon is one of our mindfulness teachers, and he is running our online mindfulness program, which has been a big hit during COVID and will continue into the future. And he will talk about the role of mindfulness and MBSR in managing sleep disturbances. Sandy Templeton is an occupational therapist, one of our oncology massage therapists and lymphedema therapists, and she's going to be wearing her oncology massage hat today and talk about the role of oncology massage in sleep disturbances and touch therapies. Marjorie Hellman is a yoga therapist, also an occupational therapist and Feldenkrais teacher, has worked with cancer patients and worked at Lifehouse also since the opening in 7 years ago, and is going to demonstrate a little bit about yoga and talk about the incredible role of yoga in cancer care, but specifically focusing on sleep disturbances. And Kim Karen Ayres is our clinical nurse consultant care coordinator, also has worked with cancer patients for a very long time, many years, and works specifically in the space of her passion, which is life after cancer, and will be giving the introductory talk on sleep disturbances. And hopefully Shelley Kay, Dr. Shelley Kay, our wonderful exercise physiologist, will work out how to join us soon and talk about exercise and cancer. So it's very rich. And so with the very limited time, this is really just a taster. and you'll learn a lot more. We'll give about 10 minutes to 15 minutes at the end for question answer, and try and make this as interesting as possible for you. Please put your questions into the Q&A box you'll see at the bottom of the screen, and I'll come to them and try and answer as many questions and queries as possible as we continue through the discussion today. So I'm going to introduce you to Kim, and Kim will start really giving an overview of sleep disturbances and cancer and set the scene for a discussion about this multidisciplinary integrative oncology approach to sleep disturbances. And I hope you will engage with us, ask lots of questions, and find this really interesting. So I'm just going to share the screen, and 1 second. And start the slideshow.
Excellent. Thanks for that introduction, Judith. So let's talk about sleep. Next slide. Great. So why do we sleep? So sleep is a fundamental biological need which is essential for recuperation, memory consolidation, performance, learning, and emotional well-being. And we used to think that everything really shut down when we went to sleep, but over the last 60 years, we've actually discovered that our brains are really quite active while we sleep. In fact, some areas of the brain use more glucose and oxygen while you're asleep than when you're awake. Next slide. But the age-old question, how much sleep do you actually need? Well, sleep needs vary significantly amongst individuals and across the lifespan. Most adults will report that they sleep between 6 and 8 hours a night, but some people are short sleepers and they require less than 6 hours of sleep a night without the need to have catch-up sleep to feel refreshed. But it's important to remember it's not just the quantity of sleep, it's the quality. Next slide. So sleep is actually categorized into two main phases: non-rapid eye movement, or NREM sleep, which consists of progressively deeper sleep stages, and rapid eye movement, or REM sleep, which is associated with dreaming. The diagram on the screen shows what the average sleep cycle looks like. And this is a cycle that occurs every 90 to 120 minutes. And there are 4 to 5 cycles that occur during a typical night's sleep. Next slide. But we know that sleep disturbance is really common, either getting to, staying asleep, or being able to get back to sleep. In a study of over 2,000 adults, around 60% of people report at least one sleep symptom occurring 3 or more times a week. The type of symptom varies according to age, with waking up overnight or early in the morning more common in older people, and difficulty falling asleep more frequent in the young. And poor sleep is reported as one of the most burdensome symptoms in cancer survivors, and it can be a really persistent symptom. In a recent study of women with breast cancer in Victoria, around half the women reported sleep problems that persisted at 5 years after their diagnosis. Next slide. Insomnia experienced by cancer patients has not only been attributed to the emotional consequences of being diagnosed with a cancer, but also to the direct effects of cancer treatments such as chemotherapy. In a study of 823 patients undergoing chemo, nearly 40% reported moderate or severe insomnia symptoms after their first cycle, with symptoms persisting through subsequent cycles in up to 2/3 of patients. The most commonly reported sleep problems by patients undergoing chemo is the inability to maintain sleep, with the disruptions being attributed to anxiety and worry related to a cancer diagnosis or treatment, but also the effects of cancer treatments themselves: pain, nausea, hot flushes, etc. And short sleep duration has been associated with a variety of adverse cardiovascular outcomes, including central obesity, high blood pressure, and an increase in inflammatory markers. Next slide. Sleep issues can be really challenging to manage, as the way that we respond can actually make the sleep problem worse or keep it going. Cognitive behavioral therapy has been found to be helpful to restructure sleep patterns by identifying thoughts, feelings, and behaviors that contribute to poor sleep. And these programs are often delivered by psychologists. I'll provide a link to some more resources at the end of the talk. Next slide. It's important that we maximize our circadian rhythms. Now, circadian rhythms are 24-hour cycles that are part of the body's internal clock running in the background to carry out essential functions and processes. And one of the best known circadian rhythms is the sleep-wake cycle. Our body clocks take their cues from environmental factors such as light, which is why shift work or daylight savings can throw your sleep out. So getting some natural light, especially early in the day, and limiting light before bed helps reinforce the circadian cue. Next slide. So paying attention to sleep hygiene is one of the most straightforward ways that you can set yourself up for better sleep. It's about harnessing habits to make quality sleep feel more automatic. So keep your routine consistent. Follow the same steps each night. That could be things like putting on your pajamas, brushing your teeth, can reinforce in your mind that it's time for bed. Budget 30 minutes for winding down. Take advantage of whatever it is that puts you in a state of calm, like soft music, for example. Try and stay away from bright lights, because they hinder the production of melatonin, a hormone that the body creates to facilitate sleep. Don't use your bed as your home office or cinema, which has been really hard during COVID. Try and build a link in your mind between sleep and being in bed. Try to avoid napping during the day if possible. But if you need to nap, and some people do, try to do it before 3 p.m. and for no more than 30 minutes at a time. Eating dinner late or having a big, heavy, spicy meal means you're still digesting when it's time for bed. So in general, trying to have a lighter meal before bed is more helpful. Trying to unplug from electronics, build a 30 to 60 minute pre-bed buffer time that's device-free. And because it's a stimulant, caffeine can keep you wired even when you want to rest. So try to avoid it later in the day. Also be aware if you're consuming lots of caffeine to try and make up for that lack of sleep. Don't smoke, it's just universally bad. But also nicotine stimulates the body in ways that disrupt sleep. And while alcohol may make it easier to fall asleep, the effects wear off and that disrupts sleep later in the night. And so as a result, it's best to moderate alcohol consumption, and particularly to avoid it later in the evening. And remember, if you can't sleep after 20 minutes, get up, do something boring or calming until you feel sleepy, and you're certainly going to get some more strategies throughout this talk. Thanks, Judith.
Oh my God, what happened? Judith, I think you're muted.
So I'll say that again. So we're probably not going to be sitting in bed with a whiskey, a cigarette, watching a movie. But I think there's more to it than that. And I think the sleep hygiene tips that Kim has given us and really race through, you'll hear more about that as we continue to talk. And we'll all be coming back to that really important component of sleep hygiene. So if you can change those basic habits, that's a really good start. So I'm going to, and thank you, Kim, for that incredibly rushed and beautiful overview of the complexity of sleep disturbance and that interplay between the circadian rhythm and cancer-related symptoms, cancer treatment-related symptoms, the treatment itself, people on steroids going crazy and not being able to sleep. And we'll look at how we can approach it in multiple different ways. So that's a great segue to Margie Hellman, and Margie's going to talk to us about yoga, and yoga is an amazing therapy. And Margie's going to give us a little bit of a some practical tips and get you comfortable in doing a bit of practice, but also talk to us about the science behind yoga and yoga therapy. Margie.
Thank you, Judith. So instead of a glass of whiskey and a cigarette in bed, how about some yoga? So I've been teaching yoga for many years, and we've all heard people who say, oh, I went to a yoga class and I slept so well that night. And that's the anecdotal evidence that a lot of people will tell a yoga teacher or their friends. We all kind of have heard that, but the news is also that there is a wealth of scientific evidence now that shows that regular yoga practice can really help restore sleep patterns and fatigue, which are often linked. So cancer-related fatigue and sleep, we know, come together, and the yoga works kind of at both ends of that spectrum. So I'm not going to go into the research because I want to give you some practical tips and ideas, but just so that you know, there is a lot of evidence, and it's a growing body of evidence. So how, first of all, you might be thinking yoga. No, I can't do yoga. I can't twist my body in knots, and I can't, I don't have any Lycra. But really, the way that we teach yoga at Lifehouse is quite different from what you might think of yoga. It's very gentle, it's very slow, it's very calming. So I'm going to give you a taste of that in a moment. But how does yoga work? Very succinctly, yoga works like many of the other therapies in the living room by bringing balance to our nervous system. We kind of have two wings to our nervous system. You've heard of the fight or flight, the sympathetic nervous system. And this is what happens to all of us, but especially when you're going through treatment for cancer. Your sympathetic nervous system or your stress response gets switched on, and it's hard to switch it off. Right? So yoga can help switch on the relaxation response, which brings a sense of balance to the nervous system. And I'm sure other people will be highlighting this, but essentially it calms down the stress response. So we have tools in yoga. We have a variety of tools that we use. We use gentle movement. So it could be as simple as, just moving your shoulders, stretching back, very simple movements. But that helps in a couple of ways. It relaxes tension physically, but it also facilitates mindfulness. Chris is going to be talking to you more about mindfulness, but I think yoga is about mindful movement and connecting to our body, okay, being aware of our body. We also harness the power of the breath in yoga, and I could talk for hours about the breath. Breath is really, the science of yoga is linked to the breath. And the breath is linked to our nervous system. So the way that we perceiving our stress in our environment affects the way we breathe. But we can change our stress levels by changing the way that we breathe. So we use the breath in yoga at Lifehouse. It's really a breath-centered practice. We also use a tool called Yoga Nidra, which some of you may be familiar with. It's getting more well-known. Nidra actually means sleep. And this is a deep relaxation practice. And it's wonderful for sleep. Before bed or any time of the day, it's going to bring your nervous system right down to an incredibly relaxed, peaceful state very quickly and without you having to have much skill. And that's what's so nice about it. So you can look online, or you can come to one of my classes and I can teach you about Yoga Nidra. I don't have time to do a Yoga Nidra now. But what I thought I would do is show you a little bit about the breath. So we're going to do a very simple, practical little breathing exercise here. What we want to do, in essence, to calm the nervous system down is lengthen the exhale. So a longer, slower exhale will automatically tell your nervous system to move into the relaxation response or the parasympathetic. And this is what we're continually working with yoga. Before I start, two things about yoga. Yoga is not like taking a pill. You have to do the practice. But the beauty of that is you begin to love doing your yoga practice. It feels good. You feel good afterwards. There's no negative side effects. But you do need to do it. But the other beautiful thing about yoga is you can do it for yourself. So it's cost effective. You can do it at home. You can learn to do your own home yoga practice, which I love to give people. So it's a great way to learn to look after yourself and empower yourself. So let's do our little practice, because I know we've got lots of different things to talk about today. So I want you to get comfortable in your chair. This will just be about 3 or 4 minutes. I could talk to you about getting comfortable in your chair for hours too, but do the best that you can. And I actually want you to put your hand on your lower belly here, okay? This is where a plexus of nerves lives, that when we start to breathe diaphragmatically and activate this area, it instantly calms us down. So you can close your eyes and I will talk you through this little experience, okay? So with your hand on your belly, just relax your shoulders a little bit, your face, your jaw. Take a nice deep breath in now through your nose and let the breath travel down through your lungs. Let your belly expand. And as you exhale, open your mouth and go. So make a soft sighing sound and you feel your belly contract. So this is how we lengthen the exhale. Do it a few more times. Breathing in through your nose, the air moves down through the lungs, the belly relaxes and expands. And as you exhale, you don't think about breathing out very much. So think about breathing out a few more times. You can do this in bed at night. Put your hands on your belly. Sighing it out helps to physiologically and anatomically lengthen the out breath. Now this is speed yoga 101, but I'm going to add a little bit of movement in because we love moving in yoga, helps to regulate the breath naturally. So now I want you to take your arm and I want you, as you breathe in, just to stretch your arm like this. Breathe in, stretch your arm up. And as you exhale, lower it down. So consciously really slow your movement down. Other arm, breathing in. Feel your body stretch and open. And as you exhale, sigh it out. Feel your abdomen. Just do it one more time. Slow down. Open your chest. Exhale. So you can eventually learn to do it without opening your mouth, but the sound also gives the mind something to rest on. Okay. So that was a very quick lesson in lengthening your exhale, but you can practice in bed any time of day. So thank you.
Oh, thank you, Margie. Thank you so much. I think that, yeah, I'm sure we're all feeling a little bit more relaxed, and the idea of getting a good night's sleep sounds so simple, but how do we combine some of these therapies? So we've heard about some sleep hygiene. So we've learned some really basic work, and I can imagine I'm a yoga practitioner. I practice yoga for many years, and it makes a huge difference to my life. And we're now going to learn. So thank you very much, Margie. It makes and we look forward to your questions afterwards. I'm going to go on to Victoria. Victoria is going to talk about the role of traditional Chinese medicine and acupuncture in sleep, and this has been a really interesting field with a lot of publications coming out in just in the last few months, actually, from Memorial Sloan Kettering and from elsewhere. It's a really exciting field. So I'll hand over to Victoria to speak a little bit about acupuncture.
Thank you, Judith, and thank you, Margie and Kim. That was actually wonderful, and that's a very nice intro to, I guess, acupuncture, being all relaxed now. Yeah, so I'll give a little bit of an overview about what acupuncture is and I guess what the research is saying and what it actually means for you, you know, the one that's actually going through this kind of sleepless periods, which is, you know, it could be terrifying. So yeah, but I think Margie put it very well, saying that yoga isn't like taking a pill. And I'm going to jump on that and say also acupuncture is also a little bit like that. And I think you'll hopefully learn from, you know, all the panelists today that the practices that we are recommending, they are a lifestyle change and isn't a simple solution, but a rewarding one. So just to kind of reiterate what Kim was saying before, I guess it's interesting looking at the stats, looking at the prevalence of sleeplessness, and it constitutes about 30 to 60% of patients with cancer who, you know, go through insomnia or varying levels of. And I think insomnia, just looking at sleeplessness, insomnia is inadequate because it's actually, most of the time, we're looking at a cluster of symptoms. And I guess it makes sense that with insomnia, you also get fatigue, anxiety and depression, and also it could be due to pain. So I think as a clinician, as an acupuncturist, for me, it's very important to investigate why you're actually experiencing this. So yes, chemotherapy can induce this. However, I think it's important to investigate what other factors could be causing the sleeplessness. And also, I do want to make the distinction that, is it the sleeplessness that you're having, or if it's actually clinically diagnosed insomnia, which is something that's done by clinical psychologists. So I think what I'd like to highlight is that there are varying degrees of sleeplessness. And so back to my point of getting down to the bottom of what's actually causing the problem. Now, why that's important is because then that actually determines your approach. How are we going to actually approach the insomnia? And also it's very opportune that, we have so many different practitioners on board today talking about their practice, because certain practices may be more appropriate for you. So for some people, acupuncture might be better, for others, yoga. It really depends on your preference, I think, as a clinician. That's what I've kind of experienced. And so I think Judith mentioned that there are actually quite a lot of research coming out, and recently in the last couple of months as well. But in the last 3 years, there's a lot of evidence coming out in support of acupuncture and its potential benefits. Now, I don't know how many of you have experienced acupuncture, but it sounds a lot scarier than it actually is. But it essentially is, you have these very tiny thin needles that are inserted, and you get to lie there and relax for 20 minutes. That's what it feels like, and that's what you would expect if you go to see an acupuncturist. But essentially, that the needles are, what we do with that is basically we kind of try and get you balanced. So what sort of online with what Margie was saying before in terms of correcting your nervous system. So that's what acupuncture is trying to do, to influence your nervous system, to calm you down, to help you induce sleep. However, so that's acupuncture, but some of the research that's coming out is the comparison between cognitive behavioral therapy versus acupuncture. And yes, as Kim mentioned, there's a lot of research out there for CBT, and there's a lot of good evidence for that. However, acupuncture, I think when the two was compared in a recent study in 2018, it actually showed that yes, CBT is slightly more effective. However, acupuncture was also effective, and there was very minimal difference between the two. So why do I say this? Basically, what I'm saying is it comes back down to, once again, your preference. And a team in the US and Canada actually did a study recently as well regarding preferences of patients. And some of the comments that the patients were saying in terms of, what they thought about acupuncture and what they thought about CBT was varied. So some people who received acupuncture, there was, the comments were, well, what is acupuncture actually doing? I'm just lying there. My problems are actually something that I would like to discuss. Whereas others thought, I can talk about my problems to wit's end and it's still not going to solve my insomnia. And so once again, boils down to what are your needs? So is it physiological? It may be psychological, or a bit of both. But ultimately, it comes back down to what your needs are and what you prefer. So if acupuncture is for you, I think when I look at the attendee list, I did see a couple of familiar names. So perhaps some of you have already experienced acupuncture, but it's something definitely worth a shot. There's good evidence to suggest that it is quite effective, almost as effective as CBT. But yeah, let's give it a go, I think.
Thank you very much, Victoria. I think for those of you who've experienced acupuncture, you'll really understand how it treats the whole person and not specifically the ailment. And this is an area which we're really interested in. The work by Jun Mao at Memorial Sloan Kettering and his colleagues looked at comparing an acupuncture treatment with cognitive behavioural therapy. And I think that's a really exciting study to see that they're as effective as each other. And that's showing that this is really about what sits well with you and what works with you, and whether a combination of some of these therapies actually further improve sleep will be the next phase of their study. So thank you, Victoria, and we look forward to questions afterwards. Now, the lovely Dr. Shelley Kay has managed to join us by audio, and I will put up her slides here. And this is a problem when you're not at work today and you decide, and you're really so passionate about our cause that came and joined our webinar. So welcome, Shelley. Are you there?
Yes, can you hear me?
We can hear you beautifully, and I feel like I'm Eurovision. Shelley, do you? I've got your slides up here, and I will just share them. And
yes, that's great.
If you'd just like to start,
I'll speak. Yeah, that's great. I'll just speak you through pretty much what it says there. That the relationship between physical activity and sleep disorder is bidirectional. So what does that mean? People with lower physical activity levels usually have higher risk of insomnia, and in reverse, people with sleep problems have lower physical activity levels. In the big picture, people who have a high fitness level report very much lower insomnia scores. So here's the problem. People who can't sleep are too tired to exercise, and people who don't exercise can't sleep, and it just goes around. On the next slide, the research shows that in an experimental situation or just a lack of sleep, there's a decrease in cognitive performance, mood, glucose metabolism, people get hungry, their immune function goes down. And exercise, whether it be aerobic or resistance, reverses those decrements by improving all of those factors. During sleep, your nerve cells are having their glucose levels replenished, and that gives them energy. And in the awake cycle, your body is using those glycogen stores. So when you think about that, no wonder you're tired, both from the nerves in your brain and the body exceeding its amount of glucose that it's allowed to have to keep the brain still going. So is it any wonder that there's a lot of physical and mental fatigue that goes along with that insomnia? So it's really interesting that exercise actually stimulates a number of brain growth factors that go in and help the neurons in the brain repair. And exercise also helps anxiety, depression, fatigue, and pain. And so in a secondary manner, it can help with those other factors that then impact sleep. On the next slide, here's just a group of good research studies that show that exercise helps a lot of people who are either surviving from cancer or during their treatment. Colorectal cancer, breast cancer survivors, pancreatic cancer and colon cancer survivors all have improved sleep, some component of their sleep, as a result of an exercise intervention. And in the colon cancer, there seems to be a dose response. So people who are exercising like an hour of walking a day, 5 days a week, they had the greatest improvements. In multiple myeloma, which is a different type of a cancer, there were no reported benefits. And it's possible that they're taking the Donald Trump drug and that they're really, really running around cleaning the house late at night. In endometrial survivors, there's an association between physical activity and improved sleep, breast and prostate, and non-Hodgkin's lymphoma, but not across all the lymphomas. And there was no improvement in a study of high-intensity interval training in testicular cancer survivors. But then in this study, it was unknown if those people actually had sleep deficits at the start. So there's a whole range of exercise research studies showing improvements in sleep, whether at 3 or 6 months or into survivorship. So that's really good news. on the next slide, and there's a click there, you'll see that that panel there shows you that when you're comparing exercise in cancer groups, that the exercise groups are having better reductions in their insomnia compared to the usual care group. So that's really good news, both on a research perspective and across a whole lot of studies, and there are quite a few more. So in summary, on my next slide, what kind of exercise is good? Well, the previous panel showed that any type of exercise is a helper, and it's a part of an holistic approach, as you've already heard from the other speakers. Now, recommendations commonly suggest exercising earlier in the day. However, different times affect different aspects of sleep, such as the length of time it takes you to get to sleep or the waking after sleep onset. And there's all kinds of variations, and it has to be individual, what works for you. For example, a resistance training study showed that doing these strength exercises an hour and a half before bedtime had an increase in deep sleep and reduction in REM sleep. And on top of that, it shows that people who do something a little bit harder, like with a little bit more exertion, that seems to reduce that very shallow sleep. So there are multiple factors there, but the big picture is that any type of exercise will help. Finding the right time of day for you so that it doesn't interfere with your downtime, so the exercise has revved you up, and then the time to just get things back to the relaxation state after the stimulation. Leaving enough time is a really important thing. So there are different effects from just a bout of exercise and from the one single and the regular exercise. For example, a bout of exercise improves total sleep time, sleep onset latency, and reduces REM sleep, whereas regular exercise improves sleep quality and total sleep time. Now, in the clinic, it's really common that people who are coming in tell me that they sleep better on their gym days, and I think that's great. So if anything can help, and you have a whole menu of options here, then exercise is one thing that it might take time, but I think it's a valuable tool in that toolbox. Thank you.
Thank you, Shelley. And so we know that exercise is really good for so much more than just sleep. We also know that sleep is there's interesting studies looking at the benefit of sleep on your immune system, on your ability to fight infections. And it's a little bit of a plug for a podcast that I'll be hosting and we'll be recording next week on the science of sleep and sleep disturbances through integrative oncology talks. And so you'll be hearing from some even more about sleep and the science of understanding sleep and this integrative oncology approach to sleep and well-being. So we're not going to be smoking and drinking whiskey, lying in bed, watching a movie. We'll all be exercising. Acupuncture is for anyone who hasn't experienced it and has any sleep disturbance, fatigue. I think it's really worthwhile trialing it. We're all going to be doing our breath work through our yoga and realize that we don't need to bend and stretch and twist to be practicing yoga. And now we're going to hear from Gretel, who is considered one of our magic women here, people here at Lifehouse. She's not only the bowel queen, but also sometimes the sleep queen. And she's going to talk a little bit about reflexology and what it is and why it helps people sleep. Now, we realize that we may be running a little bit late, but if people are happy to stay on, we're happy to go for an extra 15 minutes to allow more discussion at the end. So you don't need to race off, but I understand that if you can't stay on, this will be recorded. So I'll just go to the next few slides. Welcome.
Thank you, Judith. Thank you, everybody. And I must tell you from my experience of 7 years working in the living room with all my lovely integrative medical practitioners, I have become a healthier, happier person meditating, exercising, doing regular yoga and acupuncture and massage and reflexology. And I feel a better, healthier person for it. Now, what is reflexology and how does it work? It's an ancient healing art that can be traced back to many ancient cultures. And the technique is to apply pressure and massage techniques to particular maps, a bit like the one that's on the screen now, that appears on the hands, the face, the feet, and the ears. I particularly like working the feet, and as you can see from that, we can really cover little reflex points that relate to every part of the body. And in a treatment, we work the plantar, the dorsal, and the medial and lateral sides of the foot that cover everything. So in our treatment, we have absolutely worked every aspect of your body. And it's a safe treatment. It helps combat stress and anxiety by promoting relaxation. And the main aspect of reflexology is it encourages the body's self-healing process to bring the body back into balance or homeostasis. One of the most common feedback I get is that if patients haven't fallen asleep on the table, they will tell me they had the best night's sleep. The next slide, please, Jude. Thank you. This is a very important acupuncture point, actually, on the sole of the feet. It's kidney 1. The interesting thing about reflexology is that we work the hands and feet, and most of the meridians finish and start in the hands and the feet. So maybe reflexology, they don't know how it really works, but we are stimulating those points as well. And this particular point is also known as the Chinese sleep point, or the whirl point, or the bubbling springs point. And it is one of the most powerful points on the foot, which does get worked quite well during a treatment. But if you want to work this yourself at home, a simple golf ball placed on that point and just rotated for a few minutes prior to sleep and first thing in the morning is a really good way to stimulate that. And it has a powerful relaxing and calming effect on the body and mind. The main thing I wanted to share with you is I've got a wonderful research paper, happy to share with anyone. It's the effects of sleep hygiene, education and reflexology on sleep quality and fatigue in patients receiving chemotherapy. And the conclusion was that reflexology did help patients improve their sleep, but only when they included a sleep hygiene education. And I can relate to that. If we have time, I wanted to share that I had a knee injury that I've had for 2 years, and I can tell you it disrupted my sleep so badly that I tossed and turned for so long. It was really hard for me to get a very calm, relaxed, peaceful sleep. So I actually had to implement all those sleep hygiene points that Kim shared with us in the slide. I also had to make sure I had a comfortable mattress, really supportive pillows. I even bought a body pillow to rest my knee on. And it was only by cutting out caffeine and reducing my alcohol and increasing my exercise, meditating before I go to bed, doing yoga on a regular basis, that I've been able to actually get my sleep back into a normal state, which I'm very grateful for. Thank you, everybody.
Thank you, Gretel, and thank you for sharing that with us, Gretel. I think those people who suffer from sleep disturbances will agree how significantly different they feel after a great night's sleep. And it's interesting, isn't it, when we did a survey of patients and looked at the main reason they used the living room and their main complaint, it was sleep disturbances at number 1 after reduced well-being. So you realise how important a good night's sleep is. And as Victoria pointed out, it's those clusters of symptoms like pain keeping you awake. But if you sleep well, your life is better. And so we're all going to get golf balls as well and start rubbing our feet on those golf balls. So I'm going to now hand over to Sandy, our wonderful massage therapist, lymphedema therapist, person, all trades, educator, and really nice person to talk about touch therapies and massage. And we decided that we weren't going to have slides so that we can look at you in the as we speak. So I'm going for every speaker. So I'm going to hand over to Sandy to talk a bit about touch therapies and their value.
Thanks, Judith. Hi, everyone. I think the subject of massage is probably one of the most well-known amongst our panelists today. So I won't talk a lot about the mechanisms of what massage is doing, but I will explain that oncology massage is a little bit different to the regular high street massage in that it's extremely gentle. And when we meet people with cancer, the thing that we're most present to is the amount of stress that they're experiencing. And so that stress can be emotional stress, it can be physical stress, they can be feeling completely unwell, they can be feeling okay, but their emotions are, running them, their adrenaline's running them, or who knows what people's coping mechanisms are. But the thing that gentle massage does is that it regulates a lot of those chemicals that are in the brain, and that it helps bring the nervous system down to a calmer state. So Margie's already talked about the effect of breath with that. Gretel's pointed out that we can access certain meridians in our body to help regulate that. Victoria has talked about Chinese medicine and the tools of acupuncture and how they can help regulate all those chemicals that are going on in our brain. But we do know that massage also can help access that toolkit that's in our brain and help bring us down to a more calm state. And for a lot of our people, they might live alone. They might not have other people that are able to support them, and give them something as simple as a reassuring hug. And so massage has that ability to connect with people's skin and give them a sense of profound nurturing. And so I think that's where we have this unique ability here in the living room with our skilled and trained oncology massage therapists that can really pull all those elements together to help support people. We know that when we gently stretch the skin, it impacts the lymphatic system. When the lymphatic system is working better, it helps boost the immune system. And so we're having this duality of boosting the immune system, but also regulating the nervous system. So I guess the beautiful aspect of massage is it's non-invasive, like all the therapies that we've talked about today. It's safe when you are held and supported and nurtured through gentle touch, then your body is allowed to calm down. And then people, as they have said with all our other therapists here, after our treatments, often the comment is, that's the best night's sleep I've had in ages. So if you can't afford to actually pay for massage, then perhaps there is a way that you can have someone in your community, give you regular hugs. Just touch your body, get the stretch mechanism on your skin, and that will help perhaps just break that cycle of the poor sleep. So I don't think there's anything else I need to say, Judith. Over to you.
So thank you very much. And I know that we're close to time, so I'm going to do the question a little bit later. I will say that we're really interested also in the endocannabinoid system and sleep, and that's the role of cannabis as an exogenous endocannabinoid, but also interested in whether there's the endocannabinoid system helps keep our body in balance, and we're looking in, is that a contributor to the response from massage, the response from acupuncture, the response from exercise, that we're actually restoring that homeostasis in our body. And when is it that you need to use exogenous or outside of your body cannabinoids to get your body back into balance? And when can massage, acupuncture, yoga, stretching, reflexology, exercise actually also work in mechanisms that we're still learning and understanding to get your body back into balance? And so I'm going to introduce, before I finish, in case people are leaving the webinar a little bit on time but early, I just want to thank Andy Hanson, who is our manager of our practice manager here in the living room, for organising all of these webinars and making sure that this is all running so smoothly and so beautifully. So thank you, Andy, for your incredible work. I'm going to introduce you finally to our the man with the magnificent voice, Chris Dixon, who is going to talk about mindfulness and also take us through a brief practice. And then please look at the Q&A box and please add your questions in there so then we can respond to them in the minutes remaining. So I'm just going to share the screen again and introduce Chris.
Thank you, Judith. So happy to be here and to be able to share my skills, which are in the area of mindfulness. I just want to kind of zoom out and talk about a couple of big picture things. A lot of the speakers today have touched on the role of choosing supportive care strategies that that you find helpful. And I want to just bring to your attention that we have this sort of combination of both passive and active treatments. And so some of the treatments that you'll be receiving are more on the passive side and some are more on the active side. And one thing to keep in mind is, and the research supports this very strongly, that when you engage in treatments yourself, so when you engage in active treatments, including things like exercise, like mindfulness, that process of engagement leads to productive benefits. And that's been shown in a lot of the research, some of the research that I've done in the past, working with musculoskeletal patients. So I think it's important to keep that in mind. You become more self-empowered when you engage in these treatments. The other thing about all these treatments, and in particular mindfulness, is that the goal of these in supportive care is to reduce the suffering and symptom burden that you experience as you undergo treatment and then move into cancer survivorship. From the clinical perspective, and there might be some clinicians who are viewing this webinar, it's important to keep in mind that when a treatment is tolerable, a patient is more likely to adhere to treatment. So supportive care within that framework is very important. So what is mindfulness and why do we do it? In a nutshell, if we could just go back to the previous slide. Thank you. Mindfulness practice actually provides us with greater clarity about our stress, our distress, our reactivity. And it gives us a range of practices that allow us to make changes or respond in more helpful ways. So mindfulness does this by increasing awareness of our thought processes and our experience as it arises in the present moment. It also gives us the training and inner resources to attend to our physical and psychological experience with greater understanding. We can do it with less reactivity, with greater kindness and acceptance. So I'll talk specifically about using mindfulness with sleep in a moment, but I've just put up a couple of pictures here that we use in our mindfulness course to illustrate what it's about. And in this picture here, you see a person and a dog walking, and it's a pleasant day. And what is the person doing? They're just thinking about stuff. And we're all very common with that experience. And what is the dog doing, of course? It's just enjoying being in the moment. So scientific research has shown that we spend half or more of our time lost in thought or mind wandering. So in this state, unaware of our thoughts, we're more likely to be susceptible to negative thoughts or automatic responses. As Sam Harris, the neuroscientist, put it, the habit of spending nearly every waking moment lost in thought leaves us at the mercy of whatever our thoughts are. So mindfulness is a way of breaking this spell. Can I have the next slide, please? In this picture, we have a baby, a cat, and a goldfish. And it's a symbolic description of two different responses. So the cat has one thing on its mind, but the baby is filled with curiosity and wonder. And as a result of that, their next actions will be affected by their initial assessment of the fish in the bowl. In other words, it's our relationship with experience. Could I have the next slide? I'm just going to go over these slides very quickly, simply so that you have them on your record. And you can read these in your own time. Next slide. I just want to focus on this about how mindfulness works in a very specific way. So John Kabat-Zinn, the founder of the mindfulness-based stress reduction program, puts it in this succinct way. It's about paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. But I kind of like a later description by Shapiro and Carlson, one of the big mindfulness and cancer researchers, which is we're working with our attention with a certain intention and attitude. And I'll be talking about this very shortly. So next slide. For those of you who are interested in what happens when we practice and the mechanisms of mindfulness, I refer you to this article. But basically, those kinds of 4 categories that you see on screen are the ways in which mindfulness works in us. Next slide. I've put here some references for you to look at, which is some research into the psycho-physiological effects of mindfulness. And as you can see, it's not only good for psychological issues, but it can actually change our brain structure and even work at the cellular level. So telomeres, there's been some research into telomeres, which degrade over time. And you can see that mindfulness even helps at that sort of foundational level, as well as things like pain, blood pressure, and inflammatory markers. Next slide, please. The field of mindfulness research and sleep has really just started to blossom over the last couple of years. And I've put a couple of systematic reviews that you can also look at, which show that mindfulness is very helpful to sleep. Next slide. Could we have the next slide? Great. So how do we bring mindfulness to our sleep? I just want to really focus on these 3 important aspects: intention, attention, and attitude. So starting with intention, the first thing is make a genuine commitment to getting better sleep. We all know about sleep hygiene, or hopefully we do now. So one of those things is to actually bring an intentionality about getting better sleep. And that means doing all the things that you know are good to support that. The second thing is, when you're in bed and you're having problems with your sleep or so on, mindfulness provides us with a set of tools working with our attention so that we can focus on our breath or focus on our body and actually take our attention from those kinds of thoughts that are going through our head that might be distressing. So it could just be worries about our treatment or how we're doing, or it could be just the fact that, we're awake and we can't get any sleep. So with our mindfulness, we can just come back to our breath repeatedly and create a more restful state that allows us to hopefully fall back to sleep, or at least be less stressed as we are in bed at night. And the third thing I just want to finish with is our attitude. So if we're having a difficult night's sleep, we can actually just approach ourselves with a sense of kindness and compassion and know that, yes, this is difficult, but that's a different kind of attitude to one of being restless and agitated. And between those two different states, you can already imagine that treating yourself with kindness is a much more productive and beneficial process to be engaging with. So I just want to finish with that final slide with some contact details to let you know that we run mindfulness at Chris O'Brien Lifehouse through 7-week courses online. We have one-on-one sessions, and also we have a number of clinical trials and research that we're currently engaging in. And if you'd like to be involved in those clinical trials, please be in contact. So wishing you a good night's sleep tonight. I believe I have to do a little mindfulness practice. Is that correct, Judith? Do we have time for that?
Yes, please. I think that would be really good. I'm just going to share one other slide and then I'm going to take down these slides. And this is something that, and as I said, this webinar will be on our website, and we'll send all those people who are registered for the podcast a personal link as well. And here are some resources that Kim has put together. Obviously, we've given you a lot of information today, and there aren't really many questions. So I thought we'll go to the questions and then we'll finish with a meditation, if that's okay. And I'm just going to close the slideshow and just throw up these questions. And then as we're finishing, we might end with just a short meditation run by Chris, because it's a really nice way to end the day, end this part of the day and start the next part of the day, but don't fall asleep. So there's a question, the cancer survivors now finding fatigue levels rising after 2 years plus on chemotherapy. That causes me to sleep and nap frequently with low energy levels. Sometimes this spills over into sleep disturbance, which is driving the behaviour, fatigue or sleeplessness. And I guess the challenge to that is, as we said from the start, and Kim, maybe you wanted to comment on that relationship, that, and this comes up so much, obviously, in survivorship clinics that you're involved in, doesn't it? Do you want to just make a comment?
Absolutely. It's one of the most common things. It becomes this, when you look, you're often seeing a lot of these symptom clusters happening together. So a lot of what we do is tease out what is causing some of the problems and the impacts, and then trying to find solutions that work with people that are really multimodality and lifestyle based. So looking at diet, looking at exercise, introducing mind and body therapies that can be beneficial. But it often these patterns have developed over a period of time, and it does take time and it can take work to actually unpick that and provide a package that's going to be the right fit for the person.
And what I was saying, and I guess what we do is we look at those combination of sleep disturbance with cognitive impairment, with fatigue. Look, are there any drugs that you're taking that may be impacting on your sleep? Is there anything we can do to improve the fatigue? If we fix the sleep, will that improve the fatigue? And it is just trying to put all of that together. And that's what I do in my consultations. That's what Kim does in her consultations, Victoria in hers, and we all approach from different angles. And we all talk together as a team once a week about the complex patients and as to what best suits the person and the approach. So thank you for the question. The other question, it was, do cannabinoids have a role here, or is that more about pain management? So thank you for that question. I think there is a real interest in cannabis and sleep disturbances, and there are a few studies happening at the moment at the Wilcock Institute and other institutions looking at the role of cannabis and sleep. For some people who have tried everything and seen sleep specialists and really have profound sleep disturbances, cannabis may have a role. The limitation is that most of the studies and the work in cannabis at the moment includes THC, which means that you can't drive if you're taking it, so you can sleep. So it's the impact on your quality of life. A recent paper actually just published on the impact on driving is possibly going to change our driving laws, but we'll probably have to wait a little bit longer for that. And so the answer is yes. In brain cancer patients, we published and presented our study on the impact of a cannabis product, which was THC and CBD and a whole plant product on people with GBM or glioblastoma multiforme, high-grade glioma, who aren't driving anyway, and a dose of cannabis at night significantly improved their sleep and profoundly improved their function during the day. So there is, it's a very interesting space to be working in. So that's the answer to that question, and I can talk for a very long time on that, but we don't have time now. Any more questions? And is there anything that anybody from the panel wants to raise before we go to a meditation? I guess I think for me, this has been a real opportunity to showcase a little bit about the way we approach common problems for cancer patients during treatment and post-treatment, whether you're living with advanced cancer or living after cancer. It's really working out how we can best personalize a treatment for you that can empower you to manage your daily life and your well-being and your symptoms a lot better. And that's what we try and achieve here in the Living Room. So please contact us and we'll be very happy to support you. I think we'd like to close, since there aren't any more questions at the moment, with the gift of a meditation led by Chris. And just for a few minutes, a couple of minutes, just to let you experience the beauty of this as a therapy.
Thank you, Judith. So we're just going to spend 2 minutes intentionally in an active way for your own mental and physical well-being. And so I just invite you now to gently close your eyes and just bring awareness to your body. So just bring your attention to your body and just be aware of any areas of tension or stress or discomfort, and just seeing whether you can adjust those areas. You know, you could move your sitting bones closer or your spine closer to the back of the chair so it's better supported. Or you could lower your shoulders, or you could move your hands and feet in a way so that they're evenly spread or supported. And just in that simple process, you notice just by getting in touch with the body, I can actually make some small changes that bring me a sense of ease. This is an example of mindfulness in practice. But we might now just move our attention to the breath and just deepen our concentration on the breath. So find the breath in your body where you experience it most strongly. So noticing the in-breath, noticing the out-breath. You might notice the expansion of the chest and the contraction as the breath leaves the body. You might notice that your mind is very busy or you're getting caught up in thoughts. And if that happens, just deliberately leave those thoughts, let them go, practice letting go, and just come back to your breath as often as you need to. So focusing on the breath, noticing the in-breath, noticing the out-breath. And now just for a few moments, I want you to look very closely to see which is longer, your in-breath or your out-breath. And if it helps you, you could count your breath silently. Just take a few moments to settle on the breath and pay very close attention to what it's doing. If your attention wanders, just bring it back to the breath as often as you need to. Maybe noticing the pauses between each breath. Coming back to the breath. When you hear the sound of the bell, just slowly open your eyes and come back to the room.
Thank you, Chris. Thank you, Gretel, Sandy, Marjorie, Kim, Victoria, Sandy, Shelley, and of course, Andy for making all of this possible. Thank you, everybody, for joining us for this session. The recording will be available within the next 2 weeks, according to Andy, who is behind the scenes. And we're going to be taking a break over the rest of December and January to enjoy the summer, enjoy our first break since COVID. And we'll be back with more webinars in the beginning of February. So we look forward to you all joining us then. And if you go to our website and hit on podcasts and webinars, or to our YouTube channel, you'll be able to find all our previous webinars and this one as well. You'll also be able to find all our Zoom classes and contact the LivingRoom at lh.org.au or 8514-0038 to make an appointment. Thank you for joining us. Thank you, everybody. I think this has been, I've learned a lot. I think it's just wonderful always exploring what else we can do to keep people living well with cancer. So I look forward to seeing you in the new year. Thank you.